Good morning, and thank you for joining our July 16th Lunch and Learn. We're gonna go ahead and get started at this time. So if you haven't done so yet, please go ahead and mute your audio, and we'll get started.
Hello, good morning, everyone. Today's agenda, we will begin with the introduction of our HCDD Director and Outreach Staff by Ms. Onika Porter. Then we will have a COVID-19 mini commercial, and then we will have our community liaison, Becky, introduce our speaker for today. And we will come back with our upcoming outreach events by community liaison Pedro and our final remarks by Ms. Onika Porter.
Good morning, everyone. I'm Onika Porter, and I would like to introduce Tom McCaslin. He's the Director of the Housing and Community Development Department. I would also like to introduce the outreach team. I am Onika Porter, the Administrative Manager. I would like to introduce Latasha Smith. She's our Community Involvement Coordinator. Pedro Sosa, he's a Community Liaison. Becky Benitez, she's a Community Liaison. And Dejanay Jones, she's also a Community Liaison.
Officials plan to open another site in North Houston, along with 4 others.
And so it's putting together the infrastructure to be able to say to the state and to our federal partners, look, we've got the infrastructure to go. If you get us the supplies, the vaccines, we will get them out very, very quickly.
The city hopes to administer doses of the Moderna vaccine to 100,000 residents this month. Those eligible to get the shot must be in phase 1A or 1B of the state's distribution plan. That includes those 65 and older or at a greater risk. Also, those who were the first to get the Pfizer vaccine will start getting their second doses this week. Today marks 21 days since Vaccinations started. Meanwhile, the goal originally was to get more than 20 million Americans vaccinated by the end of 2020. As of Saturday, though, the CDC reports only 4 million initial doses of the Pfizer and Moderna vaccine have been given.
Good morning, everyone. Our special guest today will be Corey Warden. He's with the Houston Health Department.
All right, it should be up here in just a moment. So I appreciate the invite to speak with y'all today. Always great to speak with like-minded people. So I'm Corey Warden. I'm the safety advisor with the health department. Officially on paper, I work for HR risk management, and then of course, I live and work with the health department. So we've been doing the COVID-19 response now for, goodness, about 20 months. And we've made a lot of great progress. So we'd like to talk about that today. And of course, if there's any questions or any concerns, we'll be happy to address those as well. So you see here, this is the COVID-19 update. So this information comes through the health department, through all of our different agencies and divisions. And officially it comes through our Chief Communications and Public Affairs Officer, who is Scott Packard. And I'll be speaking to this information today. So first things first is the situational awareness overview. So what this tells us is what's going on with the pandemic. So as we can see here, we're doing better. You know, over the last year, the last 20 months, we've had some points where the infection rates were, above 20%. Now we're doing a lot better. We're down, below 5%. So as you see here, the average cases are down, the positivity rate's down, hospitalizations are down, and most importantly, daily new deaths are down. So that's fantastic. That means that we're going in the right direction. And to do that, of course, we want to continue to vaccinate. So the vaccinations are ultimately what provides a great deal of protection, along with all the exposure prevention that we've been doing for the last year. So you'll see here that the Harris County threat level has decreased. So, at times in the last year, we were up in severe. Now we're down to moderate, which is a level 3. So that's good, because what that means is that we're saving lives, we're preventing illnesses, and it's preventing hospitals from being pushed over capacity, which means that our infrastructure is going to be taken care of. So like we said there, the big part of that is the vaccinations. And the vaccinations, of course, they come in several different forms, and they're widely available. So what you see here is the numbers on that. So with the vaccinations, with several of the different versions, which are the Moderna and the Pfizer, they come in 2 doses. The Johnson & Johnson has the 1 dose. So you'll notice there it gives numbers. So for the Houstonians with the first dose, we're about 59%. And for the Houstonians that are fully vaccinated, which means they have the optimal level of protection, they're at 52.6%. So we're doing very well, but of course we do have some room for improvement there, some opportunities. So we want to continue to vaccinate, and we want to continue to encourage everyone to get that level of protection when possible. So you'll see there that the numbers also are stratified by the age groups. So when we're talking about our older population at ages 60 plus, then we have 90% that are fully vaccinated and 99% that are at the first dose. So that's really good. That means that if there's a potential vulnerability or potential for heightened severity from the virus, then we're getting more vaccines out there. So that's great. So as far as the vaccines, a little bit of information about that we get a lot of questions about and we're happy to share is that, like we said there, with the Pfizer and the Moderna vaccines, they're 2 doses. So within that, we want to make sure that people get the first dose and they come back for the second dose, which is generally about 21 days later. So once you get the second dose, then 2 weeks after that, that's considered fully vaccinated. So that's the optimal level of protection there. And then with the Johnson & Johnson, which is a single dose vaccine, then that's 2 weeks after that first dose. So with that, we want to make sure that we're going to practice good exposure prevention until we're fully vaccinated. And the reason for that is that we want to prevent any exposures, which is going to prevent the infections while we're waiting for that full vaccination to come into place. And so within the exposure prevention, of course, that's everything we've been talking about, which is going to be the social distancing and the hand hygiene and all that, and avoiding large congregated crowded areas. And there's more to it than that, of course, but if there's any questions, we'll be happy to address that. So with that, as you see here, once we have the full vaccination, that's where it's going to provide a lot more opportunity, so we can kind of get closer to the pre-February 2020 living. And so once the full vaccination is in place, then we can resume a lot of those activities, which would be things like going to events and getting around lots of people and being able to not wear a face mask for droplet containment, and being able to keep the social distance. So basically we'll be able to like we said, get closer to that pre-February 2020 normality. And then of course that applies as long as it's not as long as those exposure prevention protocols are not required by federal, state, local, tribal, or territorial laws, rules, or regulations. And of course, as you've all seen from the correspondence coming from the mayor's office, then that keeps us up to date on what's required or not required from the city. So as far as travel, when we have the full vaccinations, it also enables more there. So when we have the full vaccination, then travel doesn't require the COVID-19 test before or after, or the self-quarantine after travel. So we're now back to the point where we don't have to get the test, and we don't have to stay in isolation for the 10 to 14 days after the travel, so we can avoid spreading the virus. The vaccination provides that good level of protection. And so then from there, the important part about travel is that we want to be able to know what the situation looks like where we're going. So for example, the infection rates may be very different from Houston versus another state or another city, and then it may be very, very different in another country. So we want to make sure that we look ahead and we're able to figure out what that looks like, and we can take the appropriate precautions. So what you see here is if we're leaving the United States, we don't have to get tested before we leave unless it's required where we're going. And that, again, we can definitely check that out and make sure we know what's required for the destination. And then what you see here is that you have to show the negative test result or the documentation of full recovery from COVID-19 before boarding an international flight to the United States. So we want to make sure that we're mitigating any viruses that are being brought into the country. And then from there, we still want to get tested 3 to 5 days after international travel. And that's just a due diligence measure to make sure that we know if there's any potential for exposure after returning. And then as you see there, we do not need to self-quarantine after arriving in the United States. So the important part is that we have the full vaccination. We do the diligence with the knowing where we're going and what the risk level is there. We do the testing when we come back from an international location, and that prevents the need for the self-quarantine. So you see here, as far as the testing, this comes up a lot because, of course, the testing was highly encouraged, especially back in around March, April, May of 2020. And so now that we have the vaccinations, it provides a lot of that protection. So you'll see here that the testing is mainly going to be if you have symptoms of COVID-19. That's definitely a reason to get tested, which will be any of those symptoms, especially respiratory distress, undiagnosed cough, fever, any of the things that are on the COVID-19 listing, which is it's a pretty inclusive list there. So we definitely want to check that. And if there's any reason to believe there are symptoms, then it's always better to get tested, so we know that if it's COVID-19, we can take the appropriate measures versus if it's a common cold or influenza, which are risky in their own right, but different than COVID-19. Then you'll see here that people without symptoms, so even if we don't feel the symptomology there, if we're not fully vaccinated and we've had close contact with somebody who has COVID-19, it's a good idea to get tested because there may be an exposure. And COVID-19 can be spread when asymptomatic. So even if we're not feeling it, we can still spread the germs. So we want to make sure that we know if we do carry it. And then you'll see here, if people are not fully vaccinated, but they've been in an area that may be higher risk. So for example, you've been around a lot of people that may or may not be potentially infectious, then it's always a good idea to get tested just to be safe. And the tests are still very available. We have four major testing locations at the Southwest, Magnolia, Acres Homes, and Hiram Clark multi-service centers. And there's also a mobile community testing team. So those are definitely available, and you can always check on the HoustonEmergency.org to see where those sites are and what hours. And they don't require appointments. They're very accessible and very convenient. So with the vaccines there, you'll see that the vaccine is a huge deal because it provides that level of protection. They're approximately 95% effective, and they're literally what made the difference between the infection rates that we were looking at in 2020 versus what we're looking at now, which is a huge difference. So the vaccines are great, and you'll see there that there were large clinical trials that were done among all very inclusive, diverse groups, and so we can make sure that they're valid and reliable and safe. And then you'll see there that we cannot get COVID-19 from the vaccine. So it doesn't have a live virus in there that's going to get us sick with COVID-19. However, there may be temporary symptoms. So we may see things like fevers or fatigue or headaches. I can personally attest to that when I got the vaccine, I did, I felt a little bit down for the next day and a half. It's normal. And what that means is that your body is developing the immunity against the virus. So that's actually a good thing. And we find that typically the second shot tends to have a little more of those side effects than the first because it's giving that much more protection. And then you'll see there that even if we've already had COVID-19, I know there's a lot of talk where people sometimes feel like if they've already had it, their body has a natural immunity to it. But the reality is that vaccine is still going to provide the optimal level of protection. So even if we've had the virus, it's not necessarily valid or reliable that we have the natural immunity. So the vaccine is a wonderful thing. It's going to provide that full efficacy. And then lastly, of course, the vaccine is free, and it doesn't require ID, proof of residency, citizenship, or insurance. So it's not the kind of thing where there's going to be any kind of administrative burden or anything that may make it inconvenient or inaccessible. So again, we certainly recommend the vaccine. It's definitely what made a lot of difference with the infection rate, and it provides a lot of protection, and it gets people back to where they can, they can do a lot of things and see a lot of people that they enjoy being around without having to worry about the virus. So last couple things here. With the vaccination sites, we have mobile vaccination teams, and we have locations where the vaccinations are given. So they're very accessible, very convenient. And what you'll see there is that they're located across the city. So we have them in many communities, many areas. So they're very available. We can call the go on HoustonEmergency.org, and that can be set up there, or we can call the numbers, and the call center would be happy to set it up for us. If we need assistance for disabilities, we can definitely provide that, and we can even provide transportation. So the intent there is to make it as available and accessible and convenient as possible, so that we're able to get as many vaccinations to as many people as we can, because ultimately that's what's going to provide the protection, which will continue to decrease the infection rate, and ultimately that'll get us completely out of the pandemic. Because of course at this point we do have a good number of people vaccinated, but we also have a lot of people that are not vaccinated. And so with the variants such as the Delta variant and the Lambda variant coming around, and there's still, that give or take about 5% infection rate, then there is a possibility that the virus can still be picked up and there can still be spreading particularly among those that are not vaccinated. So we certainly recommend that and encourage it. It's definitely a benefit, and it's certainly worth feeling a little bit sick for a day to get that protection. So you see here, it's got a lot of information about the different locations at times. If there's any questions, feel free to check out the website or call the numbers at the call center. And of course, the team is happy to help. We've done this for many months, and it's certainly safe and effective. So with all that being said, as you can see there, we talked about the situation with the COVID-19 pandemic, the vaccinations, how they're beneficial, how they work to provide protection. We talked about the way those are available and convenient, and we talked about the need for testing, particularly if there's not a vaccine, if somebody's not vaccinated, and or if there's a potential for an exposure such as not being vaccinated in a large congregation or in a potentially high-risk area where there's people who are potentially infectious. So the testing is always a good thing, and or with those travel requirements as applicable. But at this point, if I can help with any questions, I'm always happy to. Again, I appreciate y'all's time today.
Thank you so much, Corey, for joining us on today. We're going to check the chat to see if we have any questions. We have a question here. Can anyone go to those locations, or is it only for city employees?
Anyone can go. It's certainly, for everybody. So there are a couple of locations that we do that you may have seen the email that went out over the last 2 weeks, where there were some locations that were set up specifically for city employees. And some of those have, restrictions, such as if you don't work in that facility, you can't go get the vaccine there. But all these that you see on the screen right now, those are for everybody. They're widely available and accessible, and anybody can make an appointment or just walk in.
Okay, we have someone typing another question at this time. One moment.
Sure, thank you.
Is there a drive-through vaccine site near IAH?
There used to be over at Will Clayton Parkway. There was a vaccine location that was at the parking spot location where they had the park and ride. I don't believe it's there anymore. You'll see the ones on the screen right now list out the sites that are in place, and then we also have mobile teams that are in the communities that set up different locations that we can find on HoustonEmergency.org. But I don't believe that the Bush Airport location is there right now. Okay, so it looks like a question regarding the Delta variant. Very valid, good question. So with the variants, what that means is that there's the COVID-19 virus, and then of course viruses have a unfortunate habit of mutating. So the variants, we have the Delta variant, there's the Lambda variant. They tend to originate from different geographic regions, and sometimes they may be more contagious than others. So with the Delta variant, the good news is that the vaccinations provide protection against it. So there's not a need for a different vaccination, and it's not the kind of thing where the vaccination is ineffective against the Delta variant. So we certainly recommend the vaccination because it's going to provide that protection. The not so good news is that the Delta variant does exist. We're finding that it is popping up. approximately about 10% of the cases that are coming along. And there was a situation in Galveston just a couple of weeks ago with I believe it was a church camp where they had a situation with some Delta variant cases there. So it is around. Like we said, there's the the group that's vaccinated has the optimal protection. The groups that are not vaccinated, they do have the risk that if they are exposed, there's a chance that a heightened chance they could catch the virus, including the Delta variant. And so for those that are not vaccinated, we certainly encourage the vaccine. And then while not fully vaccinated, we certainly encourage exposure prevention, which would be things like avoiding large crowded areas indoors, keeping social distance, all of the things that help to prevent exposure to the virus. It looks like here.
Also, okay, go ahead.
Oh, I'm sorry, I didn't interrupt you.
Also, how does this affect the current vaccine effectiveness?
Right now, it doesn't. As we stand right now, the vaccine is still equally effective, including the Delta variant. So that's the really good news about it. We certainly recommend the vaccine. It's going to help protect. And then it looks like there's another question here. Does the COVID-19 test detect the Delta variant? And yes, it does. So the good news there is that the COVID-19 test will pick up if there's a presence of the COVID-19 virus, and that also includes the different variations of it.
Okay. Let's see. Are there any more questions that you'd like to add to the chat, guest? All right, Corey. Well, we do thank you for joining us on this morning, Corey. I don't think that there are any more questions for you at this time.
Oh, great. Well, if anything comes up or any concerns, feel free to reach out. We'll be happy to help further. And again, we appreciate your time today.
Thank you, Corey. You have a great one.
You also, thank you.
So this is Pedro, and we have our upcoming outreach events. We have the 360 Road to Home Ownership Series, Road Rules, What to Expect, July 22nd, 2021. You may register now. We also have our virtual Lunch and Learn, which will be about homelessness, awareness prevention, and transitional housing. That'll be August the 20th, 2021, from 11 to 12:30. We appreciate everybody joining in. Thank you so much and hope to hear and see you soon.
Again, we would like to thank everyone for joining us today. If you have any additional questions that you may think of once the Lunch and Learn is wrapped up, please feel free to send your questions over. We'll get all the questions answered. And if you have any questions about our upcoming events, please feel free to email us. We'll answer any questions that you may have. Feel free to register. Feel free to tell anyone about the events that we have coming up. Thank you guys and have a nice day.